Good morning, everybody. This is Dr. Lombardozzi with Kempsville Chiropractic, and the topic of today, or the topic of the week, is going to be pregnancy and chiropractic. Over the years, I'll tell you, I've seen many pregnant patients, and just to give you an understanding on exactly what chiropractic is first, if you happen not to be a patient here, as chiropractors, our main focus, our main emphasis is on someone's spine and their nervous system. We work with all the other joints in the body, whether it be shoulders or knees or elbows or feet. However, our main focus is on the nervous system because your nervous system controls and coordinates the function of everything. So when you look at your nervous system, obviously it's your brain. Your brain turns into your spinal cord that comes down through your spine. Nerves exit out in between the bones. And when the nerves exit, they branch out into thousands of branches. And your nervous system controls and coordinates every cell, tissue, muscle, organ, every system in the body. And even though your nervous system controls everything, because your nervous system is kind of like the electrical system or the computer system, it controls everything in the body. However, only 10% of your nervous system feels pain. So this means you can have problems going on sometimes for, 10, 15, 20 years and you don't even feel it yet. So when you look at chiropractic in patients that we see in this office, number one, we see a lot of pregnant patients. Number two, there's a lot of obstetricians, a lot of OBGYNs that refer patients in here. And probably the number one reason why is because when someone's pregnant, obviously the OB does not want someone taking medication because the medication actually gets into the bloodstream, gets into the baby, and it's not good for the development of the baby. And number two, our focus as chiropractors is obviously to find the underlying cause of the problem and correct it, not hide it with medications. So if you happen to be pregnant, obviously you do not want to be taking medications because number one, it's not the best thing for you because as everyone knows, medications have side effects. And number two, it's not good for the baby. Probably the number one symptom we see in patients that come in who are pregnant is probably sciatica. Sciatica being there's nerves that come out of your lower back and they come out and shoot down into your legs. So when someone's pregnant, as they start getting larger, as the baby starts growing, they start to gain weight relatively quickly. They start to come back into extension a little bit. And seeing that there's a series of 5 nerves that come out of your lower back and go down into your legs, a lot of times we'll see people coming in where they have pain that's running down into the buttocks, pain going down into their legs, numbness into their feet. And as these patients come in, obviously our number one focus is to figure out what's the cause of that problem and what's the best way to correct the problem. Now, other benefits, when someone happens to be pregnant, as we start working on them, as we get their pelvis moving properly, as we restore proper nerve supply, and we get things functioning really well, these people deliver a lot quicker and with a lot less pain. So those are 2 great benefits too. Thank you so much for being part of our educational series. And if you know of anyone that could benefit from chiropractic care, especially if they're pregnant, just click on the link and give us a call. Look forward to seeing everyone. Have a wonderful day.